Um, this other way here. Welcome to Reconnection, the podcast that brings together voices from around the world um, to highlight real-life challenges and breakthroughs in rare disease. I'm your host, Joanna, and today's episode brings a 12-and-a-half-hour time difference, quite literally, connecting across the globe. My guest, Aayush Goyal, the founder of MedsPartner, a platform helping patients access life-saving medications that are approved in other countries, but aren't yet available or affordable in their own. This is a widespread and heartbreaking issue and in the rare disease community. Patients discover a treatment exists, but they are blocked by regulatory red tape, financial barriers, or geography. What makes Aayush's work so important is that there is a legal solution called the named patient import pathway. Yet most patients, doctors, and advocates have no idea this option exists. Aayush and his team have helped over 25,000 families navigate this process over the past 8 years, often bringing hope in situations that once felt hopeless. Can you start by telling us what inspired you to to create MedsPartner?
Thank you for that, Joanna, for the explanation. Uh, so, to be honest, Med's partner wasn't planned from day one. It happened naturally over time. So, back in 2016, we got in touch with a few patient groups that were specifically focused on HIV and hepatitis C. So, similarly, we got in touch with patient groups in 2020 related to cancer patients. So over these 9 years, we got the opportunity to support these patients by helping them access affordable medications in form of generics and supply to their countries. So as we got deeper into it, talked to a lot of people, it became very evident that the challenge of medicines not being available is quite widespread. It's not limited to a geography. It's not limited to a disease area. Right? There are a lot of challenges that many people face. Also, on a personal note, there were two cases in my extended family wherein two infants required in separate cases certain medications. So these medicines were available only in the US and were very, very expensive. So, that feeling of not being able to access something that is available already and that could help your loved ones. So that is really painful, and you think of doing something about it. So all these things naturally, resulted in Med's partner. And in Med's partner, our main focus is to raise awareness about this process so that people know that there is a legal and safe option of importing medicines when it's not accessible, and uh, finally they have the right to know this option whenever they are in some challenge.
So how big is this problem globally when it comes to patients being unable to access medications that are available in other countries?
So I think it's much bigger than most people realize. There are various reasons due to which medicines are not accessible. So firstly, some patient groups may not have insurance at all due to some reasons. Then there's a big group which have insurance, but uh, due to the certain eligibility criteria, they are denied insurance by their insurance provider. Then there are cases where a medicine is under shortage and it's not available locally, right? There are also expatriates who are working in some countries, and due to some reasons, they are not covered under the national insurance. So all these scenarios result in patients making very difficult choices. They, so some people I've heard that they kind of compromise on the treatment that that is ideal for them, that would benefit them the most, or they have to decide, on bearing the cost of that medicine, and it actually affects their families financially in the long run because it's a very, very high expense that they have to incur on a regular basis. I tell you about some reports. Uh, like WHO mentions that over 2 billion people across different countries, they are not able to access essential medicines. And that's almost 25% of the total population. And it's not limited to low and middle income countries only. It also includes high income countries. So that's the macro level situation. If you talk specifically about the US, there was a study which mentioned that around 25% patients, they either skipped medications or they did not fill their prescriptions just because of financial constraints, right? A recent study of July 2025 done by Pan Foundation. So, they did a poll of 2,000 participants, and all these participants had a rare condition or some chronic disease, and all of them were covered by health insurance. Still, 54% of all people, they mentioned that they were denied access to medicine by their insurance provider at some point of time. I have a report, I can share it with you as well. Uh, so this is the condition. I mean, then they are transferred to AFPs. AFPs also offer some solutions in forms of manufacturer support programs or charity fundings and all. But at the end of it, the people who were referred, out of those, 60% again said that finally they were not able to access medication. And this is the situation, especially in cases where the medication is very expensive and it plays a big role in the in treating that disease. So due to health budget constraints or whatever, they are denied access. uh, if you look at a more practical example, if you go to Reddit, you will find a lot of threads of patients discussing about the situation that they are in, repeatedly insurance providers denying coverage of medicines. And moreover, we ourselves have supported so many thousands of patients. So I mean, these were all in form of cases where they were having difficulties in accessing medications, and hence, they decided that person importation may be an option to to manage it. So I mean, if you consider all this, this is just about people who are aware. There are so many people who are not aware. I mean, 25% is a huge number when it comes to such expensive medicines not being covered.
So what type of conditions do you um, most often see people reaching out about?
So many patients, if we talk specifically about rare conditions, people reach us out for idiopathic pulmonary fibrosis, IPF. Then there are patients of Wilson's disease, uh, alkaptonuria, tyrosinemia. Then there are patients of pulmonary arterial hypertension. I mean, all these are the cases where thankfully we have an affordable medication available that may be helpful for them. Then there are patients of, cystic fibrosis, spinal muscular atrophy. These patients, unfortunately, I mean, there is still no generic available uh, anywhere, and patients are actively looking for some option they could have, because ideally these these people are reaching out because the medicine is not covered. The patented medicine is not being covered under their insurance. That's the reason it's not accessible, and they're looking for an affordable one.
Most of our listeners are either from the US, UK, or Canada, and many might not be familiar with this program. Let's see. Can you explain what named patient importation is and why it works and how it works?
Okay. So, Joanna, the usual process of medicines being available in a country is that a medicine has to be registered there, right? So, it's a long process of quality verification and registrations in different departments. I mean, it happens through that, and then it's widely available in that country. But named patient importation is an exception given in cases where if a chronic medicine required for a chronic condition, it's not available locally, then patients may source it from other countries, right? So now the regulations and documentation required, it varies from country to country. If we talk specifically about the US, as most viewers are from there, in general, the conditions of personal importation are quite strict, right? But still, they have given some exceptions based on certain conditions. So the conditions are, the medicine has to be for a chronic condition. Medicine can be imported only for personal use. There cannot be any resale of that medicine. Uh, at once, a patient can import only 90 days of medication. That's the limit. They cannot exceed it. Uh, Finally, I mean, most importantly, a valid prescription needs to be there from a licensed healthcare provider. And in general, patients are not allowed to import controlled medications, the psychotropics and all those things. So, I mean, under all these guidelines, personal importation can be made. But on the other hand, if we talk about Canada, Canada in general does not allow personal importation. Uh, they allow importation only for cases where there is no alternative available in the local country. I mean, they do not consider cases where the cost is a factor, and due to cost, the patient is looking to import it. The only exception is that maybe people working there on a work permit or are there on a study permit outside nationals. If they are residing in Canada, they can import it based on personal use. Similarly, in UK, it's allowed. I mean, in UK, patients can import medicines up to 3 months easily with a prescription. So these are the different scenarios, and depending upon the country, it varies. And coming on to the process of importing, it's quite simple. Uh, the patient first needs to have a valid prescription from their doctor. They need to, identify a reputed source, a supplier of medicines, assess the, quality of medicine that they are going to import. And, once they provide the documents and all, the supplier they pack it and ship it through some express courier, and it takes usually 5 to 10 days to reach them. So the overall process of actual importing, it's simpler given that the documentation is in place, given the regulations are being followed. So within 10 days, you can access that medicine.
So, what kind of problems have you run with doctors who, because a lot of doctors haven't heard of this program either. So is
Yeah.
from what
So
you're doing.
yeah, the reason I feel is that in general, governments do not want to promote it upfront. The ideal way is that medicine is registered, they have more control, the government has more control over the quality and everything. This named patient import was initially established as an exception. It has to be used in rare cases where there was a challenge in accessing medicines. But what happened over time due to rising healthcare expenditures, rising conditions, and restricted budgets of the government, of the insurance providers, there is a increase. I mean, there is a very high need being felt amongst patient groups, and that's the reason it has become much more important to consider this option. Uh, I mean, still there are many people who are aware about it. According to a study, uh, around 1% of the US population, they are already using personal importation for their regular medicines. I mean, that's established number. And in fact, if you have heard of the recent MFN policy, drafted by the US government, most favored nation policy for the pharmaceutical companies. So they have basically asked pharmaceutical companies to lower the prices of the patented medicines. Uh, Otherwise, they mentioned, specifically mentioned in the draft, that they would be more liberal with the personal importation. So as I mentioned, there are some restrictions, uh, with respect to the clarity of policy of personal importation in the US. But in this draft, they specifically mentioned that personal importation would be made more liberal. So that kind of indicates that even the governments understand the impact personal importation can have in addressing the situations where medicines are not available to to a large group of population.
Are there risks and or misunderstandings about this model that you are often have to address?
Yeah, so I mean, there are a lot actually because there's less awareness about it. Um, Patients, the number one query that patients have, the misunderstandings they have, is whether this option legal in my country. Can I import it? Wouldn't I be into any problem by importing such medicine? So we explain obviously that uh, go through the regulations. We try and explain the regulations to these patients that are applicable in their countries. So as of now, we have helped patients in more than 40 plus countries, right? So uh, it depends on the regulations, what are allowed and what are not allowed. Then the second thing that many people have concerns about uh, is the supplier validation, right? So it is important to be aware that ideally while choosing a supplier, it is important that the supplier should have the required licenses to deal in prescription medicines. They should have experience exporting medicines to these countries in a compliant manner. So let's say, if a supplier says that uh, I'll send you the medicines without a prescription. So that is a red flag. Ideally a prescription is required. Yeah. And let's say somebody says that we won't declare the medication in the invoice. They don't create a proper invoice. They don't declare the actual medicine content in the invoice, so that the customs doesn't kind of see it. So all these things are red flags that people should be aware about. Medicine, there are provisions, legal provisions. If the medicine is going through customs, everything is transparent in the papers. They will review it and they will allow it. And that should be the process. This is also for the safety of the patient that these things are followed. If these checks are kind of skipped, then there are chances, obviously, about counterfeit medicines that many patients have concerns about. So, it's important to be aware how to avail the option. Similarly, about the quality of medicines. So, uh, patients should ask which manufacturer medicine is being, sent. What are the manufacturer credentials? Ideally, you should choose manufacturers who have a good presence in the US or Europe, in other developed countries, and generally they have a good quality standards. Uh, because in all this process you can see that government has limited role in assessing the quality of medicine. So the patients need to do their due diligence in terms of supplier verification and the quality of medicines to some extent, and then take an informed decision.
So is a doctor legally allowed to prescribe a medication that's not available in their own country
Yes,
if you're
I
getting it
mean,
from a
if
different country?
they, yes, they are. I mean, the thing is that if they are confident, that the reason is, again, as I mentioned, there are myths and misunderstandings about what quality of medicine would be received,
Mm.
right? So there are concerns about counterfeit medicines being received. There are risks about low quality medicines being received. So that's the reason doctors, you know, do not upfront support it at times. Or, I mean, I have a lot of doctors who themselves are guiding patients to access these medicines because they are, confident about the quality of the source and everything. They have tested it. So, I mean, it has to be done in an informed manner, I would say, since
Mm.
since government departments have limited overview of the quality process and everything.
Without revealing identity, can you share a story or two that captures the impact this has had on a rare disease family?
Okay, so I'll tell you about a lady in the UK. Her father had multiple myeloma, a rare form of blood cancer. Uh, he was prescribed a medicine called lenalidomide, and due to their specific, eligibility criteria, whatever reasons, the insurance provider, they refused to cover the medicines, and the medicine costed somewhere around 3,500 pounds per month of therapy, right? Uh, so as the disease progressed as well, they were shifted to a more advanced therapy. Like there was an advanced therapy called pomalidomide, and that costed without insurance something around 8,800 pounds per month. Yeah. So I mean, again, that was a difficult choice that lady, tried to find some solutions. She, she maybe whatever she told, she consulted, patient groups. She read patient forums online maybe, and then she came to know about the name patient option, name patient importation option. And through some reference, she got in touch with us and she sourced the medicines at a fraction of the cost that she was asked to pay there. So after the treatment around after 18 months or so, she contacted us and thanked us about the extra years that the medicine could add to her father's life, and at the same time the the method how it prevented her from being financially broke. So she was specifically, thankful about that. So there are a lot of stories, patients going through such different situations, and this personal importation has changed the conditions for a long time because many medications you see, they are not one-time medications. Uh, they have to be taken on a month-on-month basis. Some people, especially in rare diseases, I've seen that they have to take it lifelong. So I mean that's a huge burden. Uh, yeah, that's it.
What countries are the most challenging, and and which are getting it right?
Yeah, so many countries here in Europe and Canada, they do not allow personal importation in general. They allow medications only when if afford if an alt no alternative is available locally, right? So they do not consider the cost factor, the financial factor. Similarly, in Africa, there is a challenging thing. The policies are not clear related to personal importation. And due to that, when the medication reaches the destination customs, they apply very high duties, right?
Mm.
On the other hand, there are countries like Australia, New Zealand, they have a very clear personal importation policy. You can go to their uh, Ministry of Health's website, and they have properly drafted the name patient importation policy. They have mentioned the conditions that are that are required to do it, the documentation that is required, and all this kinds of create a very a conducive environment and instills confidence among patients that government is also giving us an option to use it whenever required.
How did you see the biggest? Let's see, where do you see the biggest opportunities for policy changes?
Okay, so I think I believe that government is by default the custodian of their citizens. I mean, uh, they are responsible for providing the appropriate healthcare, appropriate medicines that are required to every individual. So let's say due to any reasons they are unable to provide that, they should give this option to patients to take the decisions for their own. They should, actually permit personal importation explicitly so that, if they are not able to help, then at least patients have some option. The second is, I would say, as in many countries, the policies are not very clear. You know, uh, although these countries allow personal importation, we have helped a lot of patients in these countries, but there is no clear guideline followed. I mean, clear guideline in public domain. So, I mean, these a clear policy related to personal importation should be drafted by most countries and should be available publicly on their websites. Thirdly, I would say that patients are already using this option when they are facing a hard time financially. So import duties, customs duties, they should be ideally waived off in such cases of compassionate importation, or maybe a very small amount may be charged on these imports, right? At the same time, when if the governments kind of wants to raise awareness about it, it would also help in uh, patients taking informed decisions. So, I mean, governments can actually raise awareness about the parameters that should be kept in mind before importing, as we were discussing about the quality parameters and everything. So when it comes from the government, they kind of share information about how to verify suppliers, how to verify medicine quality. So it gives tools to patients in that country, resources to the patients in that country to you know uh, have right information in assessing it and using this option in a safe manner.
What can patient advocates and nonprofits do to raise awareness about this access option?
So the first thing, Joanna, I genuinely believe and I say always that patient advocates must first themselves get convinced about the whole process, about the regulations, you know, uh, because a patient who may be in need, uh, at present he or she must be going through a lot already. So they may not have the time to, assess everything, to understand this new concept and everything. So it is important that, the patient advocates understand it, verify everything, and then maybe after they are confident and, they are satisfied with the whole process, they kind of share information with the patients. Okay, this is the refined information uh, that you may look into. Because I have seen, I have talked to a few patient advocates earlier who are more quite vocal about affordable medication access, but at times, they are not very uh, supportive, or they are not very upfront in raising awareness about personal importation as an option. I mean, I genuinely believe that, aware they make I mean advocating for such causes, it's beneficial in the longer run when you kind of change the healthcare systems due to regular advocacy, regular, you know, uh, raising the issue. At the same time, patients who need the medicine right now, they should have an immediate short-term option to manage their conditions. And if patient advocates finally they need to raise awareness about it, they need to maybe share articles about person importation on their website as an option in general, just for the informational purpose. That can be done probably.
So what are you hoping in terms of collaboration or let's see, let's see. What are you hoping for in terms of collaboration or support from the rare disease community?
So, ideally, as I mentioned earlier, that MedsPartner wants to raise awareness and wants to reach each and every patient to whom this option can be a welcome hope. But ideally, we cannot do it alone. It's very important that patient advocates, rare disease communities, they come up and raise awareness about it. Uh, as I earlier mentioned, they may, I mean, these different patient groups, they may uh, publish articles about this option on their websites. Firstly, I mean, we also help provide resources in terms of informational articles. Then, if the communities want to maybe you know spread awareness about the Meds partner services, we can you can share brochures related to the whole process, how it works and everything. It's a simple guide, how this works, what is it. So these brochures can be distributed amongst the patient groups. Then we also organize free Q&A sessions among patients. So I mean patients who may have some questions, who may have doubts, they can clarify it in the Q&A sessions, in the online Q&A sessions. So these are the different things that maybe rare disease communities can help facilitate. I mean, facilitate in terms of information sharing, facilitation in terms of doubts clearance, right? So these are the things that I feel that the communities should be more uh, open to.
Is there anything MedsPartner is currently working on that that you would like to share?
So till date, we have been able to support patients in 40 plus countries. Uh, Firstly, we are trying to increase that number. We are trying to reach as many countries as possible. That we are doing through reaching out to patient groups in these countries, so that a solution can be worked out. Secondly, we are also working on including options of medicines that may be helpful and are available in different countries. As of now, we are mainly offering generics available in India. Although India is it's the main hub of generics around the world. Even in the US, most of the generics are manufactured in India. But still, there are options in different countries as well, which which may not be available in India, and that we are looking to incorporate in the overall product offering that patients can be helpful.
Mm. Uh, so a huge thank you to Aayush Goyal for joining us from India and shedding a light on a critical and often overlooked part of the rare disease journey, access to treatment, which is available when it's available, but out of reach. His work with MedsPartner is a reminder that hope isn't just about finding a diagnosis or discovering a new therapy. Sometimes it's about learning there's a path to access what already exists, and making sure that path is visible to every family everywhere. In today's conversation, if today's conversation helped you or sparked sparked an idea, please consider subscribing to our connection on your favorite podcast platform or YouTube at Rare Chef. And there is a underscore in between Rare and Chef on that if you are searching for it. If you're watching this video version, if you're watching the video version, drop a comment below. We'd love to hear from you. If you're listening to the audio version, you can you can click on the send me a text link in the show notes. You can also follow Rare Connection on Facebook, X, and formerly Twitter and LinkedIn to stay up to date on episodes and advocacy efforts. And finally, if you or someone you know is struggling, please know you are not alone. In the U.S., you can call or text 988 for the Suicide and Crisis Lifeline, or reach out to crisis text line through the crisis text line by texting home to 741-741. Help is always available. Thank you for connecting. I'm Joanna Ball, and I'll see you next time on Rare Connection.